That, I guess, seemed reasonable at the time to some people, maybe to many people. But as the pandemic wore on, evidence began to mount that school closures and masking kids and separating desks by 6 feet wasn't lessening infection or mortality rates compared to European countries, for example, that quickly reopened school doors. Nevertheless, in some areas, schools stayed closed for nearly a year and a half. And according to a new book, we are now seeing the very real effects of that on children in their both learning and their mental health. In the book, An Abundance of Caution, author David Zweig also argues that the decisions made to keep schools closed were based less on actual evidence and more on contrived benchmarks and political tribalism. It's a damning assessment, and David Zweig joins me now. Congratulations on the book. It's extraordinary. Okay, we all remember where we were, March 2020, when the globe, planet Earth, it felt like, shut down. Schools shut down. And 2 months later, in May of 2020, schools in Europe reopened. Nobody did that in the United States. Why the difference?
That's right. The end of April, beginning of May, 22 countries in Europe began reopening their schools. Millions of children. This wasn't a tiny schoolhouse in Tibet in the mountains somewhere with 12 kids. Millions of kids. And this was ignored or dismissed by our public health authorities and largely by the legacy media as somehow bizarrely irrelevant. And that set us on our course where we were basically divorced from what's known as evidence-based medicine or evidence-based public health.
Okay, so weeks go by, months go by, children in Europe aren't dying en masse. Why didn't we then look and say, oh, hold on, we can send our kids back to school in America?
These are really good questions. I spend 450 pages trying to explain how is it that something so manifest, something so harmful and ridiculous when you had evidence existing, empirical evidence in front of us. Unfortunately, a large part of it has to do with tribalism in our country.
Politics.
Politics is a large part. Because of the public health establishment tends to lean in one direction politically, and also our legacy media shares that same political direction. Anything that Trump said was basically radioactive. And
we should just say, too, like, you're not some right-wing crazy guy. You're not.
I approach this topic apolitically. I've written for the New York Times, The Atlantic, New York.
Okay.
I am not a right-wing ideologue by any stretch.
Okay.
This was hard for me to report and hard for me to take in.
Okay, so here's the thing. The American Academy of Pediatrics came out with a recommendation saying we think schools should open. A few days later, President Trump posts on social media, reopen the schools with, as you put it, many exclamation marks.
Right.
And what does the American Academy of Pediatrics then do?
The Academy reversed its guidance immediately after Trump's tweets. Gone was this idea. They initially very aggressively said, kids need to get in school. They said, don't worry about 6 feet of distancing. If you can't do it, 3 feet is fine. Just get them into school.
They reversed themselves just because Trump said, open the schools.
I mean, we can't prove that that's what happened, but people can look at the timeline. There was nothing that changed epidemiologically in that span of time for them to change the rules. It happened immediately after Trump's tweet. And I have lots of other examples beyond the AAP that showed that there was a deep, deep type of tribalism and groupthink amongst these powerful institutions in our country, where we had this kind of manufactured idea of a consensus that didn't really exist in reality.
And in fact, kids were paying a huge price for this. And you go through all the different ways our kids were being hurt by the fact that they were sitting at home, not going into class, barely learning. We have mental health issues. Child abuse actually went up because the people reporting it are teachers, and they were no longer seeing these kids.
That's right. One of the things that's not talked about is, and this was known as early as April of 2020, child abuse cases skyrocketed. The reporting went down because kids rely on teachers and educators as their first line of defense, as someone who spots them that something's wrong. Instead, These kids were left at home with a monster, many of them, and they were harmed because of it. We hear about learning loss, rightfully so, and this has tremendous lifelong effects for kids, but there's so many other things that happen to them that have profound life consequences. Think about a kid who's a poor child in the Bronx who's relying on a football scholarship to get into college. Maybe he's the first one in his family. I spoke to a guy who works with underprivileged youth doing football. What do you think happens to him when that football season is terminated? His life is permanently altered. That doesn't show up in the statistics. And not to mention the smaller things, the canceled senior prom. You don't get to do third grade again, ever.
And the learning loss. Most importantly, the learning loss,
Yes.
which you can't just go back and backfill.
But it's important for me to say, people may be thinking, well, yeah, but they did it to save lives. It's very important for people to understand this saved 0 lives. The evidence was clear before the pandemic. Lots of the academic literature explained why this would be the case, and we certainly saw that within the evidence throughout the pandemic as well.
Okay.
Closing schools did not help anyone. It only harmed kids.
So what about listen, you and I both were talking in the commercial break before this. We remember the fear was palpable then. We did not know a lot about this virus. As parents, we both know I'll send my kid into school and half the class gets sick with a stomach bug. Viruses are like, those classrooms can be petri dishes for viruses. Wasn't it intuitive to think, wait, I can send my kid and 10 kids in the classroom get the stomach bug? Wasn't it also sensible on some level to assume maybe they'll all go to class and 10 will get COVID?
Everything you're saying makes intuitive sense. And for a very brief window in March, it may have helped in some areas to close schools along with everything else. But what we see is that our intuitions are often wrong. And I give a zillion examples of this in the book, particularly with medicine. And what happens is, over a period of time, the implementation science shows us that people don't comply with things that are hard to do. And that includes staying home and staying isolated. Children weren't never going to be isolated once you move past a few weeks, let alone months. And don't forget, a significant portion of our society was always circulating from day one. Schools closing them was never going to be effective. And we saw this with the cellular phone data, which I talk about in my book. You could see people were moving about before they ever even changed the lockdown orders.
And you were getting emails from doctors saying they disagreed with closing the schools. It wasn't based on science, and they were afraid to speak up and say so.
That's right. You know, beyond the AAP example we talked about, after I started writing articles that sort of ran contrary to the establishment view, people around the country started reaching out to me, including physicians at some of our top institutions, including former CDC officials. And they said, thank you so much for writing about this. What's happening to kids is wrong. This isn't based in good evidence.
Okay.
And nevertheless, they were afraid to speak out, and they were even told by administrators, you are not allowed to contradict Anthony Fauci or the CDC. People had a misunderstanding. They were misled about what the truth was.
Thank you so much. The book is An Abundance of Caution. David Zweig, it's great, disturbing material you put together in this book, but thank you.
It's a tough read, but necessary.
All right, thank you. Hopefully we'll read and learn.
Thank you for watching. Subscribe below and download our NewsNation app right now on your phone, and you will get fact-based, unbiased news for all Americans.